Hello everyone and welcome back to my channel. Let's talk about ketamine infusion. Ketamine infusion is one of the latest neuromodulation procedures in psychiatry. Ketamine, traditionally used as an anesthetic agent, is now being increasingly used for the management of suicidal thinking, recurrent depression that is not responding to drugs, post-traumatic stress disorder or PTSD, and also recently substance use. Now let's understand how ketamine really works. The mechanism of ketamine is completely different from all other traditional antidepressants, and this is the reason why ketamine works where all other antidepressants fail. One of the main targets for ketamine is NMDA receptors. By binding to these receptors, ketamine appears to increase the amount of a neurotransmitter or neurohormone called glutamate in spaces between the neurons or brain cells. After this, glutamate then activates another set of receptors called AMPA or AMPA kainate receptors. Together, the initial blockade of the NMDA receptors and then activation of the AMPA kainate receptors leads to the release of other molecules within brain cells that help them form bridges between other brain cells to communicate with each other better. This is a process called synaptogenesis, and the bridges themselves are called synapses. Synaptogenesis occurs through gene expression, and that happens in every cell of the brain. Essentially, to put it very simply, ketamine infusion resets and rewires the brain with new thought patterns, mood alterations, and lesser emotional reactions to past traumatic events. In addition to this, since ketamine infusion also directly affects receptors, mostly mu-opioid receptors that are part of the pleasure pathway, ketamine infusion is also now being investigated for use in alcohol, opioid, and most recently cocaine abuse. Well, now that you know how ketamine infusion works, let's talk about what you have to do before, during, and after the session. The first step is to actually go and consult your psychiatrist, who will take a detailed clinical history and tell you whether you actually need ketamine infusion or not. Should the answer be yes, there are a few medical conditions that need to be managed before initiating ketamine infusion. The most common one is hypertension or high blood pressure. If you're suffering from hypertension, make sure you're taking your medications regularly and your blood pressure is under control. This is because during every ketamine session, your blood pressure is expected to spike briefly. Before coming to the facility, you are expected to have emptied your bowel and bladder. Once you're at the facility, your blood pressure will be checked before initiating the infusion. All you have to do after that is lie down and relax. A ketamine infusion will typically last between 40 minutes to 1 hour, and the dose of ketamine for all indications is 0.5 to 0.8 milligrams per kg body weight, although sometimes it may be increased up to 1 milligram per kg body weight. After the ketamine session, you will feel dizzy, heady, and may have nausea and also episodes of vomiting. The effects of ketamine stay up to a day or two. Therefore, you're advised not to engage in any high-risk behavior such as driving or intoxicating yourself with drugs or alcohol for the next day or two. A typical course of ketamine infusion is twice weekly for 6 weeks. Other commonly experienced side effects that you may have include visual and sexual hallucinations, increased heartbeat or tachycardia, an out-of-body experience or dissociative anesthesia, and vivid dreams or a dream-like experience. About 1 to 10% of patients will experience more severe side effects, and these include blurring of vision or diplopia, increased intraocular pressure or increased BP in the eyes, nystagmus or increased flicker of the eyes, low blood pressure or hypotension, and decreased heartbeat or bradycardia. In less than 1% of patients, there do occur some life-threatening side effects to the treatment as well. These include anaphylaxis or an allergic reaction, cardiac arrhythmias or an irregular heartbeat, respiratory depression or slowing down of the breathing leading to apnea, and also hypertonia or increased tone of the muscles in the body that may lead to laryngospasm or spasming of the voice box leading to choking, or fasciculations, that is trembling of the entire body. Well, the final question that you may be thinking is, when will I see the results? Well, ketamine works differently in different people. So while some people may respond very well within the first 1 or 2 sessions, others may take 5 to 6 sessions, and some others may still take more than that, up to 10 to 12 sessions. Remember, ketamine works in more than 50 to 70% of patients who have not responded to other medication. So it is more likely than not to help you with whatever it is that you're going through. Okay, thank you for watching this video to the end. I will be back with another video soon. Take care of yourselves.